Greetings. I'm Susan Spuhler, the Westford Town Moderator. Today we're here to discuss Bill number H.3361. I'll give a description of the bill. Notwithstanding any general law or special law to the contrary, all state agencies, quasi-state agencies, entities created by state statute, and subdivisions of state agencies shall identify Asian American and Pacific Islanders as defined by the United States Census Bureau and all data collected as part in any and all types of data collection, reporting, or verification. Provided further that the 5 largest Asian American and Pacific Islander ethnic groups residing in the Commonwealth shall have individually reported data as part of the total Asian American Pacific Islander reporting. Who I have with me today are Jason Liu, Dianna Ploss, Bethany Lee, and Minjin Kim. I'll give a quick synopsis of who they are. Jason Liu is a high school senior from Hopkinton, Massachusetts. Dianna Ploss is an entrepreneur, political activist, and has an extensive medical background. Bethany Lee is the director of the Greater Boston Legal Services Asian Outreach Unit, which provides legal services and support for organizing to the low-income Asian American community. And Dr. Minjin Kim is a postdoctoral fellow at UMass Medical School. Her research interests include quantitative health sciences and preventative and behavioral science. So welcome today.
Thank you.
Thank you. I'm going to read the rules. All debate will be conducted in a respectful and courteous manner in a calm and collected tone. Comments will be directed to the moderator, that's me, and limited to the subject being debated. No comments of a personal nature are allowed, and no applause or other reactions from the audience. I thank you for that. The first question is, does the bill help with medical research? I'll start over here with Jason.
Well, a lot of people that are for the bill state that it will promise to help research and also help medical purposes, but through disaggregation of Asian Americans into 5 generally broad categories through race will not be helpful for medical purposes or research. Race is very much a social construct without any biological meaning. This is a very mainstream thought, and it's, famous sociologist W.E.B. Du Bois furthermore supports this. And this is unlike ethnicity, which is biological based on DNA. So purposely, I do not see how this would be helpful in providing research. For example, one of the groups that are, categorized are Chinese Americans and Indian Americans. We know that China and India are both 2 very diverse countries with many different ethnic groups. I don't see how, dividing it into these broad categories will help in any way further medical research.
Okay, thank you. Do you want me to repeat the question? How does the bill help with medical research?
So I don't feel that the bill helps with medical research because I feel that there is enough research out there already. And I think that segregating people into different groups disunites them from America. So, but as a nurse, you can figure out what's wrong with somebody. I don't think having more data is going to help us help patients. I think we already have enough information about how to help patients. Anybody out there can do a quick Google search, and you can see that there are plenty of studies out there that show, what kind of disease that might be prevalent in a certain population. So I feel like this is a ruse, in my opinion, a ruse just to use money and to tug on people's feelings to say that we need the money to help people medically.
Okay. How do you feel that this bill helps with medical research?
Disaggregating data generally helps with understanding the complexities of various races, various ethnicities. Race is a social construct, that's absolutely true. But the way that race is understood and the way that race plays out in America is a very real thing. And especially in the medical context, we see that different ethnicities, different races experience illnesses in different ways. So for example, Chinese people face a disproportionately higher risk for heart disease. Vietnamese people, women, face a they are at higher risk for cervical cancer. All of these things we would not know if we did not have disaggregated data. And as a result of knowing these types of particulars for different ethnicities, we're able to do the type of outreach and prevention education necessary to really make sure that these diseases, these illnesses are addressed.
Okay,
and this is true not just in the medical context, but in the legal context as well. To understand the different issues and needs in different communities is important for understanding how to address these needs.
Okay, thank you. So how do you feel this bill helps with medical research?
So I can tell you based on my experiences in Asian American research. And I was an international student, Asian international student, and before I moved to Boston, I was not aware of there's a subgroup of differences in Asian Americans. But there, Asian American is a culturally diverse group, has more than 50 subgroups, and there are more than 100 dialects. And then their current national data supports only some subgroups of Asian American. It doesn't cover many of subgroups of Asian American, especially Southeast Asian groups. If you look at the national, if you aggregate the data, most often times, Asian American has the lowest incidence, lowest prevalence of disease, many types of disease. But if you're looking at the subgroups of Asian American, there's a huge differences in between the subgroups. So I think, based on my experiences and my personal opinion, the medical, it will be definitely disaggregating data will support in medical research.
Okay, thank you. Next question. Does the bill help with the language services needs of a subgroup of people?
I believe that there are many other ways to help. And also, I don't think we should be specifically targeting Asian Americans because there are other ethnic groups that also need help, ethnic groups from Africa. I don't see how or why we will have to specifically disaggregate data on Asian Americans to specifically help these targets when we can be also furthermore helping other ethnic groups.
Thank you. Dianna, does the bill help with the language service needs of a subgroup of people?
I don't believe so. I think as a nurse working at Mass General, we had a very sophisticated interpreter service. So if we didn't have somebody in the hospital, we could get it through, I think it was called Pacific Interpreter, so you could actually get whatever language. At one time we got Swahili. So it's there. The information is already there. The ability to get the information is already there. To set up another bill to say that we need different information for a different subgroup, I feel like is a waste of resources. But it also makes the people who would be the subgroup, and I don't like that term, make them feel that they're not included in America. It just to me it would seem like they're isolated. Okay. So I don't feel like it's necessary.
Okay, thank you. Does the bill help with the language service needs of a subgroup of people?
Well, I can tell you when people walk into our office and they're Asian, we can't look at them and tell them, oh, we'll speak Asian to you. That's not how it works, right? There's so many Asian groups, subgroups within the broader Asian category. And we work with so many of them. We work with Chinese people, we work with Cambodian people, we work with Vietnamese people, and they all speak different languages, they all speak dialects within those languages. Yes. And to understand the complexities of the Asian of Asian Americans is important in understanding how we then direct our services, how we don't waste resources so that we are appropriately so that we're appropriately serving the communities in the way that they need to be served, so that we're reaching them in the languages that they need to be served. And to understand where these communities are and how they break down is important for saving resources. And I don't think it's necessary just for the Asian community. I think to the extent that, when the question is why not for other races, why not, right? It's not exclusive to the Asian American community that there are differences and complexities in our immigration histories, in our cultures. And just because you are African American, Black, Latino, doesn't mean that those are monolithic categories either.
Okay, thank you. How does the bill help with the language service needs of a subgroup of people?
So it definitely helps with the language services for if you're disaggregating the data. If you're looking at the Asian Americans' language proficiency, for example, the Chinese people, more than 50% actually reported that they do not speak English very well. And that there are huge differences in subgroup. I understand that you don't like to use the term subgroup, so I can probably say that each ethnic group in Asian Americans, they have a unique, as I mentioned earlier, they have more than 100 dialects. And that the way they use medical terminology in their language is different than other population. So for example, I can say that there's no term for cervical cancer in Cambodian. So when we say, have you heard of cervical cancer, they do not know what it is. They think it is as a uterus cancer. They have a special term to call cervical cancer, which is mouth of uterus cancer, mouth of uterus. The cervixes, that's how they call. So the way they interpret the term is different by subgroups. So that's why it is important to understand each ethnic groups and provide efficient service to them.
Oh, thank you. Okay. Does this bill help with socioeconomic issues for a subgroup of people? Socioeconomic issues.
Well, again, my main concern with this bill is that it mainly targets Asian Americans, and I don't see why it's not dividing, for example, minorities from Africa or from other parts of the country, from the world, Hispanics, Latinos, into these subcategories as well to help them socioeconomically or medically. I don't see the reason why it's solely targeting Asian Americans, and so I strongly disagree with how this is helping them. I think there's other ways. Either it's to gather data from all these minorities in order to help them, or it's to not do disaggregating data. I personally do not see how it would be fair to solely target Asian Americans.
Thank you. How do you feel the bill helps with socioeconomic issues for a subgroup of people?
I don't feel that it helps, and it's interesting listening to people talk, use the word minority, and I'm not picking on you because I think you're wonderful, but I feel like words like that, hyphenated, Asian American or African American, I feel like that divides us. We never used to be a hyphenated nation, right? When I was growing up, we were not a hyphenated nation, and I feel like this bill singles out a group of people to make them feel like they're less than the rest of the population. And anything that does that, I myself am going to try to get away from using hyphenated terms. So I don't want you to think I'm picking on you again. It's just one of my pet peeves, and I just feel like we're all Americans. And when I was growing up, people came here to be an American. They did not come here to be a hyphen. So I do not think that this will help anybody.
Okay, thank you. Okay. Does the bill help with socioeconomic issues for a subgroup of people?
Absolutely, and we, to be clear, we have always been a hyphenated nation. It just hasn't been acknowledged, right? So when immigrants first came to the United States, there were Germans, there were Irish, there were Italians, and there was, as there exists today, a complexity in the histories and immigration and migration patterns that that has then played out with other countries as people from other countries began to immigrate. Asian Americans began immigrating, primarily in the 1960s when the immigration laws changed to allow for Asian Americans to immigrate, and and that was when a large influx of Chinese people came. Southeast Asians have a different immigration history. They came as a result of war in their country, war that was perpetuated by the United States. And so people that came over from Laos, from Cambodia, from Vietnam experience a different history than people from China. And they came over, people in Southeast Asia came over as refugees, and they were placed in different urban areas without much social support. And their histories and their life has played out in different ways as a result. And we can't talk about people in monolith, right? Like it's not true that every single Chinese person is rich, and it's not true that every single Chinese person is poor, right? But certainly there are certain Asian ethnicities that have suffered more difficulties in terms of socioeconomic issues than others. And without being able to understand how the data breaks down in terms of how Chinese, Vietnamese, Cambodian, Koreans, Thai people play out in terms of how they experience, right, everything. There's no way to properly and fully comprehensively respond.
Thank you. How does this bill help with socioeconomic issues for a subgroup of people?
So we are all coming from different cultural backgrounds, different educational backgrounds, and social demographic backgrounds. And disaggregation data is not to make a difference, like that we are different from others. It is a way to respect that there are differences in cultures and social. It is a way to respect the cultural difference and difference in language. It's also social demographic differences. And then disaggregating data, it really helps the people to understand the difference and respect the way to find some helpful resources to help them to prevent health, also to reduce the health burdens by providing this data. That the data is really supporting them to recognize the differences and socioeconomic data too.
The census is trying to add a citizenship question. What is the psychological impact on the Asian population? Who have to answer it?
Sure. I mean, on the citizenship question specifically on the census, this is a question aimed at causing fear in the immigrant community. It's aimed at trying to make undocumented immigrants not feel welcome in this country. I think it's important to distinguish this citizenship question from data disaggregation. We're comparing apples and oranges, and the data in and of itself and the collection of data is not discriminatory.
Okay.
Right? Like just collecting data, just collecting numbers, that is not a discriminatory thing. It's what is done with that data that is important. And we know within the context of this current administration that the immigration issues that are prevalent are driving this census question, the citizenship question. And states and groups have already sued over this question because they understand the discriminatory impact it's going to have.
Okay.
Data disaggregation is completely different in the context of this bill. What we're talking about is making sure that communities have more access to healthcare, have more access to education, have more access to social services. That can also be done through data. Right?
Okay.
Because the way that the data would be broken down would help to understand the complexities of the Asian American experience that would then provide equal access to institutions, to resources in a way that this citizenship question does not.
Okay. Thank you very much. The census is trying to add a citizenship question. I'll go to you, Dianna. What do you feel is the psychological impact on the Asian population?
So I can't speak for the Asian population. I'm not Asian, but to your point, I feel like this is a perfect opportunity for groups that have been marginalized in states like California, Massachusetts, with an overwhelming population of illegal aliens that have come in. And I think the adding the citizenship question to the census will help to draw different districting lines so that people are fairly represented. Because if you have an extra 3 million people in a state, then you're all vying for resources. So this actually can help the Asian population by having a citizenship question, because then people won't be underrepresented, right? And they won't be, their voices won't be flooded out by people who are not supposed to be in this country. So I think that it will actually help the Asian population.
Okay, thank you.
Well, as an American whose parents immigrated from China, I personally have no problem with this citizenship question. I feel like the federal government has the right to know how many citizens they have within their country, and how many people within their country that aren't citizens of the United States. I think they have that power, but I also do think that data is data. If you were to support, if you were to go against the fact that the census would collect data about citizenship, well, I'd say the same fears should be happening with data being collected by Massachusetts among Asian Americans. But I think the census itself is very much regulated in the fact that it's only asking whether or not you're a citizen. But meanwhile, this bill that we're arguing right now is very specific towards Asian Americans, asking you to categorize yourself within 5 of the biggest Asian American categories within our state. I think this is very problematic, and I think it's different, but in the same way there are some concerns with the data being collected with this bill.
Thank you. As our wrap up, I've asked all of our speakers here to give a basically a 30-second to 1 minute synopsis of why they feel the way they do towards this bill. So I'll start. Yep.
So as a nursing researcher and also as an Asian health researcher, I can speak that disaggregation data, of data is really, it can help understanding each ethnic group of Asian Americans. And this disaggregation of data is not to judge them. It doesn't increase the racism. It rather actually help them to see the difference and then respect the cultures, and to help the researchers and also community to develop some culturally appropriate healthy intervention targeting their specific needs.
Okay, thank you.
To clarify a point made earlier, the census itself already actually disaggregates data among Asians. So that is not new. That there's federal laws in place that protect for privacy. There are similar Massachusetts laws that would protect for privacy if data were disaggregated in Massachusetts. The disaggregation of data really simply allows us to have a more nuanced understanding of what it means to be American. It's about inclusivity, it's about equal access. And so when you talk about supporting the need to disaggregate data, what it is about it's about a United States of America that is about equal access. Just because you understand the differences in race and ethnicities and language doesn't mean that you're dividing people. It just means that you're understanding the cultural and immigration and histories and backgrounds of your neighbors and friends and family. That's all it really does.
Thank you.
So I just have 2 points on the bill that I think sum it up for me. One is I feel like it divides people and it divides Americans. The other is I think the bottom line of this bill, which I think most people are missing, maybe because I'm in politics, is I really feel like it's a big scam and it's a big sham. And Massachusetts gets 25% of its budget from federal dollars. So politicians work very hard to get federal dollars. And what they do with those federal dollars is they don't really help people. What they do is they give jobs to their friends, their family, their donors. So for me, the bottom line is the Asian community is being used by some of the politicians who are trying to get jobs for their friends, who in turn will donate back to their campaigns, keeping them in office. And that's the bottom line of this bill.
Okay, thank you, Diana.
All right. So going back to what I was saying about the citizen question, well, I support that only because it's not as a specifically targeted question as compared to asking for a specific national origin of your ancestors who moved here to the United States. But overall, I just want to say that I think what unites our country is the fact that we believe in the same ideals, and I think our country cannot be a mosaic of different communities. We have to be united because unlike most other civilizations and countries that have survived for hundreds and hundreds of years, our country is very ethnically diverse. And so the fact that the only thing that keeps us together is our ideals is important to the point where we should not be dividing ourselves over the color of our skin. But also, I have fears about this bill because of the future. In 2007, it was found that the U.S. Census Bureau provided the Secret Service with names and addresses of Japanese Americans during World War II to intern them in camps. I fear that this data could potentially be manipulated by even the state government for future, for future uses. No one knows what the future holds for us. But the fact that this data is very powerful is scary to the point where I have fears over it.
Thank you. We have 30 seconds.
I just want to respond to that point directly because I don't want to leave people with false impressions. It is true, I think, that the Census Bureau provided information that allowed for the internment of Japanese Americans. And it's in part because there were not the same types of laws in place back then as there are now. That is clearly an unconstitutional act. It's a violation of the Constitution, and the laws that are in place now would not allow for that.
Thank you. We'll be taking a break for our next group of panelists. We'll be right back. And we're back. I have 4 new guests, and I'd like to introduce them from my left and your right. First is Liewei Pogue. She is a PhD candidate in social policy at Brandeis University. She studies mental health, trauma-related health disparity, and is a peer counselor for immigrants. Again, to my left, here is George Shen, is an associate partner at IBM specializing in data, analytics, and artificial intelligence, and the executive director of Newtown Alliance for Chinese Americans. On my right and your left again, we have Amy Ma Sangiolo. Amy is an attorney and former Newton City Councilor and was, until recently, the longest-serving Asian American elected official in the Commonwealth of Massachusetts. Then on to my way right and your left, Dr. Haeok Lee is a professor in Department of Nursing. Her research interests include health disparities in minority populations, particularly immigrant populations. We'll go through the same way. I'll ask the questions, and you have 2 minutes to answer. And I will start this time from my right. Does this bill help with medical research?
I think this bill not only support the health medical research, I say term health science research, but also really help us to providing group-specific, culturally sensitive, evidence-based nursing practice and health practice. So I give you an example of this one. Another time, when I teaching about Asian American culture and health practice, most of my students remember me about my catchphrase, data is power.
That's right.
Of this one. And particularly when we're looking at the AAPI, Asian American, Native Hawaiian, Pacific Islanders, I was first kind of to not quite understand what is this one. Is this more like a terminology based on genetic, biology, sociology? But I got to answer this is kind of political terms of this one. And particularly my research focus is based on cervical cancer of this one, particular focus on cervical cancer prevention, primary prevention and secondary prevention by giving HPV vaccination or providing cervical cancer screening. When I'm looking at all the data from national data, NCI, National Institution for Cancer, looking at their kind of computer site, website of this one, according to when you're looking at the data about Hispanic and non-Hispanic white, African American, Asian American population, Asian American cervical cancer is the lowest of this one. So therefore, do not consider there is any health disparity. But when you look at the subgroups of AAPIs, there is really cancer of Cambodian, cancer of Vietnamese, cancer of Hmongs, really 3 times higher than any other ethnic group. So therefore, this is more like what you say is when we kind of clumps all together AAPI, there is no health problems. But when you're looking at the within group, there is a significant problems.
Okay, thank you. Does this bill help with medical research?
I happen to agree with Dr. Lee. I believe that it does. I believe more data is more power. What we do need to understand is what is happening in our subgroups. And when we tend to average out all the information, we lose all that vital information that can help medical research move forward and advance. So that's why I believe this bill will help that.
Okay, thank you. George, does this bill help with medical research?
I agree data is more power, but data is also very dangerous if not used correctly. So what I think that the fundamental problem with this bill is the approach is wrong. If you have a wrong approach, no matter how much data you could have a wrong result, and it's very dangerous. So the bill, try to track the immigrants down to the national of origin, right? So we have Chinese, Indians, Japanese, so on and so forth. How does that help if I'm saying that, hey, I came from China, and there are also people from China with totally different type of culture, ethnicity, right? In China, there are 56 different ethnic groups, not just one, okay? There's, I belong to the Han majority. There's Miao, Hui, Hui, Zhuang, there's 56. There are people as diverse as from the north part of the China, which is the Manchu, southwest part of the China, which is the Cantonese, right? You also have the indigenous people from Fujian province, those are Kejia. You also have the Tibetan, right? They have totally different culture. And if you go to the north, west side of the country, you have the Mongols, right? Inner Mongolia, that's also part of China. If you go to the Midwest and the far west part of the country, you have like Uyghurs, right? You have almost more than 30 different type of ethnic minorities. So if tag everybody as Chinese, it doesn't going to help, right? It does not help because we speak sometimes totally different language, not just dialect, right? And we also have different, environment. We have different family history, right? So there's so many things could be attributing to a disease, right? Not just ethnicity or race. You have the family history, you have genetics, right? You have the environment, you have, if you work, you have work stress related, right? You have lifestyle. So there's so many contributing factor in this question. So I don't strongly feel like race is the determinist fact. And with the modern medicine, right, you have the personalized medicine, you have the personalized pharmacy. You really, if you want to disaggregate, you really disaggregate to the extreme, to the personal level. And that truly differentiates us, from subgroups, because uniquely, we are all different from each other.
Okay,
That's what I can say.
Thank you. Does this bill help with medical research?
I want to say data always help research. However, helping research doesn't mean to helping a population. It's different. Research will first lead to publication, but the publication, we need to have an ethical bond. every publication first need to pass IRB. Why there's IRB is dictated by Belbin report. Every researcher need to consider their research subject not as data point, but as human being. So we need to respect person, beneficence, and justice. And this bill are not giving the research coded subject a real power to consent, because government is asking the data. People, especially immigrants like me, we very, very powerless in front of the state, especially in this country with this massive xenophobia. I have to say it's very sad. And especially when the government asking a question on behalf of doctor, it makes us feel we are suddenly become a land mouse. We just want to be human being without being researched. And also we need to ask why we exactly need a bill. If we just want more and more data, we need to have a specific plan how the data can be used exactly to help population. Like if I am a peer counselor for people with mental health, and I found that you can always talk with people. I don't need a bill to ask people, click, are you Chinese, are you Cambodian? I just ask, where are you from? Tell me more. They will tell me much more than where they're from if they trust me. So I just don't think we need extra bill in this current political charge environment to make this matter more complex. I agree with the mission behind the bill, try to help the marginalized population, but I just don't agree with the method.
Okay, thank you. And I'll continue on with you. Does the bill help with the language service needs of a subgroup of people?
I want to say, like, I'm Chinese. I can speak pretty okay English, but I have accent. And I have many Chinese peers who need more help with Chinese. Like I have been working as a translator for a grandmom. Then her English has real problem. And then actually we are teaching Chinese American how to speak Mandarin. They don't want to learn Mandarin sometimes, they speak English. So by lump sum, all of us, the Chinese immigrants like me, the grandmom who need English translator, and the Chinese American who need to learn Mandarin, we group them together, it won't help. So basically, a lot of disparity is led by the language. However, like we said, Asian is not language, Chinese is not a language as well. I think we just better ask, do you need language service?
Okay, thank you. So, George, does the bill help with the language services needs of a subgroup of people?
No, I don't think that's the right question to ask. When you ask somebody if someone needs help, you ask what kind of help you need. You don't ask what kind of race you are. So I think fundamentally with what's wrong with this bill is that it truly wants to see everything through the lens of race and ethnicity. And I don't think that's the right approach. Let me tell you a personal story. My son, I have 3 boys, but my first one, when he was in 1st grade, he went to school. We speak a little bit Chinese, but mostly English in our family. And he was called out from his class to ESL, right? The English as a second language class. And when my wife and I found out, we were horrified. Well, your English doesn't have any problem, right? We were telling him. And he said he doesn't think so either. So we then go back to the teachers, ask why you guys need to pick him up and put him to a different class when his language, he doesn't have any language issues. Is it because of his race? And after the evaluation of his language proficiency, they released him, right? Put him back to the normal class. And so I think you can't determine the needs based on the race and ethnicity. You have to ask the question, what kind of help you need? And you can also through tests, right? Use the language proficiency test, right? There are many kind of different tests. And not because if you belong to this race and you need language help. I don't think that's the right way to look at it.
Okay, thank you.
Thank you.
Does the bill help with language service needs for a subgroup of people?
So I'll give you an example of how it has helped. Excuse me, maybe I should have had some water before we started.
Somebody get some water.
A number of years ago, I worked with the Chinese Progressive Association in Boston and Chinatown to try to get bilingual ballots. The importance of bilingual ballots is to ensure that everyone in that community is able to cast an informed vote. Not a vote by somebody trying to translate or interpret, but that make up their own interpretation and decision making in terms of participating in the political process. And I think that is so empowering to give folks whose first language is not English, but they are American citizens, the ability to make an informed choice on who they want to be their leader in government.
Thank you. Okay. Does the bill help with the language service needs of a subgroup of people?
My response is yes, more likely, very teasing way. We do not speak Asian American languages. I speak Korean and English, and some other my colleagues might speak Chinese and English other way. So most of our some data about this kind of language difference within Asian American coming from California. We really appreciate our Asian American in California. Why not we replicate our Commonwealth? Because we are going to have more Asian population in here, more likely 20 years ago in California of this one. I just give it one good example. Sure. Because I work with the Cambodian American because they have a highest instance of cervical cancer. So my study is more like community outreach. So I visit Lowell very often because there is a kind of very dense Khmer American, Cambodian American live in Lowell. And one time, they changed their street sign from is kind of two ways from one way. And they put the sign one way. But most of Khmer, they are not able to read English. Can you believe that? And car accidents. So if they have really good data about who really frequently driving around here, so my suggestion is why not only put the Khmer there, not only English, because majority of clients around there. So this is simply one of the examples.
Okay, thank you very much. And I'll continue back with you. Does the bill help with socioeconomic issues?
Yes, even so I conduct a study about hepatitis B, the virus infection and the vaccination, liver cancer among our Asian American students at the UMass Boston of this one. And based on this, my survey, even so among college students, they are more homogeneous group, Asian American, right? But when we asking their parents' education on their monthly income, I really see that there's significant differences within Asian American subgroups. More like Chinese American, Korean American has a very high their income, more like upper 10%, 20% tier. Cambodian, bottom, more likely under federal poverty level of this one. So therefore, we do understand social factors. This is really influence on our health status, access to the health, and quality of life. So without understanding this social determinant, it's difficult to develop the intervention very specific and helpful to subgroups. So I really support breakdown data to specific group, identify who are really vulnerable population.
Thank you very much. Does the bill help with socioeconomic issues?
I absolutely agree with all that Dr. Lee has mentioned. For the 20 years that I have served on the Newton City Council and working with groups in Boston and the greater Boston area, I know that there are so many groups that need funding and more resources that are targeted to those groups. And often when we're averaged out in an aggregated sort of sense, we don't see the needs of the population, and that's what we need to do. As a former policymaker, I feel that it's very important to direct the resources to those in need.
Thank you. Does the bill help with socioeconomic issues?
I don't believe so. And it has to do with the approach again. I think race and ethnicity is not a good proxy for socioeconomic status. I think we should look at the family income. We should look at the language proficiency. We should look at the poverty level. Right? All these factors are basically contributing factor for the socioeconomic status. Right? Race and ethnicity are bad proxy. Now, let me ask you, right? It's maybe a rhetorical question, but President Obama's daughters do not need any help, and I don't think because of their race, they need. You can determine that they need any socioeconomic status. Based on their socioeconomic, they're doing very well. They don't need help, and they certainly do need more help than my kids. And so I don't think it's the right approach. I think if you want to help I recognize the need from these minority groups. And I think you use the family income, language proficiency, and the poverty level. You can identify the needs very well. You don't need a race or ethnicity.
Thank you. Does the bill help with socioeconomic issues?
I think if there is no census data, this bill may help. However, we all have census data. And census has been conducted for decades, many years, and then it's at least try to count everybody. And then also there is annual this American Community Survey. So basically it has disaggregated data of different Asian subgroup and what language the person is speaking. So because the government has spent so much money on collect this data, and so we need another bill. So I think it's better idea is just divert the effort, just go to use census data. And then we indeed must help the people who are poor. Like we see the Chinese people and Indian people, some are rich, some are poor. I know some Indian people are very rich. On average, Indian group rank at the top of all Asian, and Taiwanese probably second. But there are homeless Indian people, and where to find them? This bill is still trying to group people with very diverse socioeconomic background into a box. And being put into a box do not equal to helping them. So we must find a pathway. I just didn't find the pathway between the bill and the people who in need. I think we just need to do more than collect data.
May I respond, Susan?
Certainly.
So just quickly, this bill is not in isolation. All the other different data points that you've suggested, George, about poverty level and income level and English proficiency, those are all still being collected. What we want to do is not group us as an Asian group, because if you do group us as an Asian group, as you were saying, you do miss the differences within the group. But if you look at all the data points together, and are able to disaggregate the Asian population, you'll be able to see that there are disparities within us, and we can direct our resources to those populations that are in most need. If I would agree if it were in total isolation, but this bill is not in total isolation of all the other data that's being collected.
Okay.
Can I respond to that?
Yes.
Yeah. So what are you saying? Is basically, you already can look at other data points to determine the needs, socioeconomic needs, and therefore, it shouldn't just limited by race or ethnicity, right? Asians may need help, so are white, so are black, right? So there are so many different groups need socioeconomic needs, right? They have needs. So I think it's very limiting to look at your own race and ethnicity and try to determine what you need. I think all people underprivileged and need help, they need help, and regardless their race or ethnicity.
Okay. In the interest of time, I will let you go through and give a 1-minute synopsis as to how and why you feel the way you do about this bill.
I'm a Korean American. I was born in Korea, so my identity was Korean. But when I moved here in 1984, I just found out I was included into others. So my identity became others, not of this one. So since then, also the changes from melting pot into beautiful salad in California, and I moved here. So therefore, baseline is my data. Whenever I respond to either census or Commonwealth, I wanted my response included not into others. But as I'm U.S. citizen and I'm part of U.S. population, also I wanted to be included as part of Asian American and specifically Korean American. So therefore, we could have this disaggregating data, but we are able to aggregating together. So that is, I think, so what is the beauty of United States.
Thank you.
I support this bill. I am a proud Chinese American citizen, and I want the ability to be able to identify myself as that, not just as an Asian American. And while I do appreciate the fact that Asian Americans as a group have found more power and solidarity in a whole, we have now reached a level in our time, in our point of time, where we need to direct resources to those subgroups within our community that really need the help. And that's why I support this bill. And I believe that new versions of this bill will come to fruition, and I believe all groups will be included.
Thank you. George?
I strongly against this bill for the reasons that we talked a little bit already, but I think I want to more focus on the negative impact of this bill we have not talked about, right? This bill, I think, fundamentally is a wrong approach. It perpetuates a foreigner mindset and the stereotype of Asian American. It reinforces the racism and the discrimination against the first and the second generation of Asian Americans. It alienates patriotic Asian American like myself and my kids. And I think it's detrimental to the fight against the deep-rooted institutional and the societal racism, right? Our country has, I'm proud American, right? And I came from China 25 years ago. I feel like I'm more American than I'm Chinese, to be honest, right? And I'm proud, I'm not ashamed to say that. And I think the fundamental of this bill, it comes down to your self-identity. At the age when people can identify themselves with different gender, with different sex, I cannot even identify myself with the right race I belong to or ethnicity. I think I belong to American, right? So this is the things that I think we see things differently. And our country has very shameful history of discrimination. It's institutionalized discrimination down to the nationality. I think I don't have to go through all the bills, discriminatory bills that this country passed, but I don't think this is the right approach, and therefore I'm strongly against this bill. Thank you.
Thank you.
We all say data is power. Data do not discriminate. There is another talk called gun do not kill. We want to say we don't want data fall into the wrong hand. However, we look back to history, a lot of time I just don't know who have the wrong hand or right hand, because when the data is collected, we all have good intention. However, later when the government change the head, leader, president, we don't know what is going to happen in the next step. And I'm not American, I'm Chinese. And now there are huge xenophobia, anti-Chinese sentiment in this country. We are called the whole of society threat. So for now, my identity actually gets threatened because I'm an immigrant. And in this country, what I want the least is people ask, where are you from? Because people start to have all the wrong idea what I'm planning to do. I'm a student and maybe I want to steal some secret back to China. And actually, but it's absurd, however, it's happening. This is what said by the FBI director last month. So it has impact. And then at the same time, the bill is asking every state agency to ask a new box, a Chinese box. I consider it's offensive, to be honest. And also, another is identity matter. Actually, I consider myself, the most important thing is Christianity. I convert from atheism to Christianity. Then I want to say, actually, different religions have different dietary practice. They have very different diverse health outcome because of different meat, different drink they have. Then can we ask a question called, okay, let's add an optional question about religion. You can self-identify. Can we really do that? I'm very proud Christian. There are very proud people who are Muslim and Jews. Can we do that? So I just want to say we must be sensitive to humans' heart and soul and the political environment. Thank you.
Okay, thank you. I thank you for joining us for the H.3361 bill, and we hope to have further discussions about this topic. Thank you so much. Thank you for joining us.